Still too early to let our guard down just yet. Public health officials from across the country pleading with Canadians to stay home, maintain that physical distance from people, wash your hands. Now, while the country appears to be flattening the curve in some ways, there are still large numbers of positive test results, including a rather big jump in the Thunder Bay District Health Unit. Dr. Janet DeMille is a medical officer of health. Dr. DeMille, good morning.
Good morning, Lisa.
So tell us about the most recent developments that you've had. When we talked last Monday, you had just discovered this outbreak at Lac des Îles, and I guess that one has continued to increase throughout the week.
Yes, and really that's not surprising. We actually knew that there could very well be people who were at that work site, that mine site, who could be incubating the virus, and that we might see further cases as a result of that. And so we did, in fact, over the last week. I can't remember when I last talked to you what the number was, but
it's all a blur.
But we did see other cases. I think what's really important to know, though, is that that was essentially an outbreak at a mine site where quick measures were put in place to manage the outbreak. So we're very confident that there's no ongoing spread. It's just we needed to manage the individuals who are on that site who could be incubating and they're in self-isolation, for example. So that's actually sort of managed, and I think what we'll see is less and less cases really as part of that outbreak because there's less and less people self-isolating. I will note, actually, because I know it comes up in some of the questions that we get, I'll note that there are many people who were on that mine site that have finished the self-isolation period. So they're cleared, essentially, and there are still some people left, but it's a smaller number.
Mm-hmm. And I know some numbers from this past weekend appear to be from the community contact or close contact.
Yeah, and again, not at all surprising. So when we here in public health when we hear about somebody who's positive, we quickly follow up with that person, first of all, to make sure that they're doing well and that they're managing and they know how to manage through their own illness. But we also want to quickly identify anybody that is around them that might have been exposed to the virus because this individual had it, right? And so it's not uncommon that we will find some additional cases, and they're usually people that are very close. They're perhaps family members or household contacts or somebody that they're sort of very closely connected to, and then we test those individuals. So it's not uncommon, and that just means that's really, though, what our work in public health is, to contain that virus. So we want to contain it. We want to limit the spread among just to closely associated individuals.
Okay. Now, I noticed that some of the people who tested positive were fairly young, in their 20s, and that sort of makes me sit up and pay attention. But what about for you? Is that a concern? Not necessarily. I think when you look at the data across the province, that people of all ages are getting COVID-19, and what you can sometimes see is you might see the spread within a family, and if there's younger folks in a family, then you might see the younger folks kind of being exposed and having the infection. Very reassuringly is that younger people tend to do better with the illness. They're less likely to have any significant complications. In fact, sometimes they can have really mild illness to begin with. So, as long as everybody, if people are staying home, if people are doing all of those precautions that you just mentioned, that of course we're trying to, we mention to everybody every day, really we're reducing the spread beyond those people who are fairly closely associated. How many are hospitalized, Dr. DeMille?
I think we've had, at the present time, there's 3 individuals. And I think, I think we're doing well that way. If you look at the data around illness, about 20% of people can end up in hospital, like 15% sort of seriously ill, and 5% maybe critically ill. And so the fact that there's only 3 people actually is a good indicator. It's a good indicator that
the sort of the other 80% is still a fairly low number, which is so reassuring that way.
Now, I drove past the district health unit on the weekend, and you had a weekend testing event. So how did that go?
Very well, actually. So we quickly, sort of almost at the end of the week, sort of moved forward because we had an opportunity to do this and the supplies to be able to do that, to quickly move forward to put this on. And we hadn't done one of these before, so some of the logistical issues we worked through, but we were able to actually accommodate more people than we had originally anticipated. So I think it was close to like 250 to 300 people that we actually tested, and it went really well. Like, better, I think, maybe than we had anticipated. But, and so it was a great opportunity and an exciting opportunity. As you know, testing has been a bit of an issue.
Yes.
Challenges around the capacity to do testing, and that's the swabs that you need to do testing, and of course you need to analyze the test. And then, the turnaround time, if it takes 5, 6, 7 days to get a test result back, it really is challenging to manage that. And so this was and some of that definitely seems to be changing for the better, which is really exciting for Thunder Bay and our region. And so we had this opportunity to be able to really fairly significant increase the number of testing. And it's not just us, but it's also the assessment center at the Thunder Bay Regional. They also have are opening up to be able to do more testing because we have more capacity to do it. And very fundamental and important thing that we test and we test and we test, just so that we, number one, identify people with COVID and manage them so that we're not sort of continuing to spread the virus, but also because we'll have a better understanding of what's going on in the community.
And were these people who had to show some symptoms, or how did you screen people?
Yeah, so we were screening them. We had people phone us, and we were screening them. And yes, we did want people who had symptoms, like something, like a respiratory, like a cold, or upper respiratory or lower kind of symptoms, so particular symptoms. But really, they only had to have one, and it could just be very mild. And that's just because when COVID, if you're going to pick up COVID, you can pick it up better in somebody who's actually symptomatic if their illness is actually caused by COVID. So if somebody has a sore throat, and it kind of suggests that if it's COVID, the virus is active and you're more likely to pick it up. It's much more challenging. There's limitations to testing people without symptoms. So we focused on people with symptoms, and we were able to fill up all our slots. So that was very good.
It looked busy, I have to say. Before I let you go, there's a lot of talk south of the border about relaxing some of the restrictions. I'd say some of the beaches are open, things like that. They're still fairly close to us. Does that worry you in any way?
Absolutely. I mean, in the sense that, and this is already what we've seen, right? We get people returning from the United States who have brought back, unknowingly and unintentionally, of course, brought back COVID with them. And so that is definitely an issue. I really will feel much better, not only when our numbers are not going up as much as they are, but as well when the United States and when Toronto and everybody is starting to on the downside of this first phase of this pandemic, I'll feel much better. So it's very uncomfortable, some of the stuff that I see happening in the United States. However, I think it's also very important that the border, the federal government announced that extension to the crossing the border for another 30 days. So that will be to our advantage. And it's hard to see what's going on in the States, though.
Thank you for all the good work you and your team are doing.
Thank you very much, Lisa.